Hello and welcome to the podcast. I'm Dr. Matthew Posa. Today I have Dr. Holly with me, and we are going to be talking with Alex Danks. Thank you, Alex, for joining the show today. Super excited to have you. We really couldn't wait to have you on the show because you were one of the people that I definitely wanted to talk to because of the information that I know you're going to share. And a little bit about you. We met you a few years ago, or I met you a few years ago at a was it Starbucks? It was at a Starbucks, and you were telling me all about this pelvic physiotherapy, this pelvic floor stuff, and it was really new to me, and I was kind of surprised that it was new to me, but the information you're sharing with me about that. So you are a pelvic floor physiotherapist. You also work with the running community, which is super awesome. And so welcome to the show.
Thank you so much. Thanks for having me.
And maybe just tell our viewers a little bit about you, what you do, and what led you to this point.
Yeah, so what led me to physiotherapy essentially was I played a lot of sports growing up, and with lots of sports comes lots of injuries. And I did spend a lot of time in physiotherapy clinics growing up. And I knew that I wanted to do something as a career where I'm helping people. So it kind of seemed like the natural progression into physiotherapy. So that's kind of what led me there. And then into the pelvic floor world was more, I had exposure actually before I was in physio school. I was working like admin for a pelvic floor physio. So I had never heard of pelvic floor physio in my life before that. So I had a little bit of exposure going into school. Still wasn't sure what kind of area of physio I wanted to do. But then once I went into school, really got kind of a better idea of the research, how good the research was in this field, how much you can really change someone's life in this field. Not that you can't in other fields of physiotherapy, but pelvic floor physio, you see these physical changes, but you also see people go from not wanting to leave their houses because they're afraid of, having an accident out in public, to being able to go back to their social lives and doing the things they love. So it was a journey to get here, and it's been really amazing.
Very cool. So right now you're in Toronto and in Hamilton or around Hamilton.
Yeah, Dundas, right outside
Awesome.
of Hamilton.
Yes.
Yeah.
Very cool.
Yes.
So one of the big things is, I think we got to address it right off the bat. What is pelvic floor physiotherapy? Because like I said, it was new to me. We did talk. Mm-hmm. Since then, I have a 2.5-year-old, but when my wife was pregnant, she was going. So that I saw some big changes, but I want to hear it from you since you do it.
Yeah, so pelvic floor physio, I think when people, well, first of all, if people have even heard of it, people think pregnancy, postpartum. And those are huge, that's a huge aspect of what we do. We kind of prepare the body for delivery, but we also, during pregnancy, we really work on kind of maintaining the person's health. So whether that means trying to prevent or treat any sort of pain that they might be having, that pubic symphysis pain in the front, or the sacroiliac pain in the back, hip pain, low back pain. I mean, so many different types of pain that people experience during pregnancy. And then comes what we call urinary incontinence, or the leakage. Sometimes people experience that as well during pregnancy. Even pain with intercourse, another major symptom that people do experience. So that's a big part of what we do, both with pregnancy and postpartum. But pelvic health physio also covers, kids who are having like chronic bedwetting, people who are postmenopausal, who are now, maybe they did have a little bit of a leaky bladder, and now they're experiencing prolapse, and they're kind of like, what is this? How do I treat this? Do I have to have surgery, And then there's a whole other population in the male population with prostate. When they have their prostates removed, you actually see a lot of urinary incontinence with that. And so there's a lot that pelvic health can do with that as well.
Okay, so right away, I had no idea guys could do this too.
Yeah. Some guys come in, they're like, I have a pelvic floor. Like, I thought that was just a thing for women.
I remember learning about the perineum
Mhm.
in school, so I know that thing.
Yep.
And but I didn't know guys could do it. That's like,
Mhm.
okay, so
Mhm.
there you go. I just learned something new right now.
Yeah. Yeah.
Okay, very cool. So okay, so let's say, because we see a lot of pregnancies, we see a ton of families. That's really like most of our patients, that's what it is, right? It's the full
Mhm.
family. And for us is, what's the best way to impact a family, is especially during that pregnancy stage where you can influence not only mom and decrease the stress, but then therefore you're actually helping baby.
Yep.
And then we can go from there, right? So for us,
Definitely.
that, prevention, that's always going to be a big thing. But getting that full picture and being able to help mom during that pregnancy, I think, is huge for just setting them up and their family for the rest of their life. So
Mhm.
I definitely want to speak to that. I definitely want to speak, because so I'm thinking of the mom that's maybe planning to get pregnant right now, the mom that maybe is pregnant right now, and they've never heard of pelvic floor physio. And now they're like, I don't even know if I should go. How do I go? So I got like a ton of questions. So how does someone know if they need to go, and given that stage? So I'm just talking about the mom that's like pre-pregnancy and starting pregnancy.
Yeah, great question. So before we kind of dive into that, I always kind of like to give people the visualization of what's happening in the pelvic floor when you're pregnant. So if you think about the pelvic floor, not many of us could be like, oh, I know what that looks like. It's essentially the foundation that holds up our upper body, essentially. And so if you think about it, it's like the floor of your upper body. And so now it's holding your abdominal organs, your pelvic organs, which it's used to holding, and now the extra weight of a baby. So I always describe it as, say you're holding a grocery bag, and you're holding that grocery bag for 9 months, and every couple of weeks you're throwing in another, can of beans or something like that, and you're not letting go of that grocery bag. Imagine just how tight your bicep muscle would be, right?
Pretty tight.
And so think about the pelvic floor. Those muscles, they're working super hard, especially towards the end, but throughout the whole 9 months, every time you're walking, every time you're exercising, every time you're sitting, those pelvic floor muscles have to be on at a low grade, but they're still holding everything up. So I usually tell people, definitely if you're having symptoms, pain, leakage, pain with intercourse, just not feeling like you're moving properly, that's the time for sure to come in. But ideally, I like to see people, in the first at 20 weeks is a good time, because that's when we start to see a little bit more of the tightness happening in the pelvic floor, which can lead to a bunch of other kind of discomforts that people experience throughout pregnancy.
Right. So mom's coming in 20 weeks. She's starting, has some of that discomfort, or maybe she's noticing some other big things. So you do the exam, you're checking. Now, one of the things that people won't know, and which I'll tell you, my wife came home when she went at first, because that was new to us too, right? I didn't even know anything about this. My wife comes home, she's like, Matt, you wouldn't believe what they had to do. And so she was a little bit surprised by the fact that it's hands-on, right? It is hands-on. But that is, leading later to when she actually delivered, that was the blessing in it, because when she was able to connect so much better to what our midwives were saying during that stage. So that's number one. So talk about that. So you guys are hands-on.
Yeah. So usually what an assessment would look like, essentially, we go through the normal kind of chatting about their symptoms and what's been going on, how the pregnancy has been, and everything like that, their past pregnancies, all that. We always look at kind of your low back, your hips, how is that all moving together? Because you can't look at the pelvis without looking at the low back, the hips. And then, we do an internal component as well, vaginally, sometimes rectally as well. It's all up to the patient's kind of comfort level, though. There's definitely some people who come in and are just not comfortable with it. And with those patients, we kind of have to make a bit of a hypothesis as to kind of what's going on, because we're not able to actually, put our fingers on the muscles, see how tight the muscles are, see how strong the muscles are. So we can definitely work with people externally, but the best kind of gold standard way of treating, way of assessing is to kind of work internally, because it just gives us so much more information.
All right. So you mentioned guy thing, so maybe let's not talk about how you do that part. But okay, so they're doing it. So what would a normal treatment look like? Let's say, so, okay, so now they're coming in, they get through that whole, oh, they're actually gonna be touching me. And then you started treatment. What would you say is a typical, because you've done enough of them that you know exactly, this is normally what it takes. What would you say?
So in terms of what the assessment, like the internal assessment would look like, it's essentially the practitioner would be kind of touching the muscles on the internal aspect, feeling kind of their muscles like any other muscle. You can feel a knot. Are they quite tight? Are they, am I able to move them well? And then I get them to actually do a Kegel, and I describe kind of how to do a Kegel. There's a lot of visualization, a lot of breathing aspects to it as well.
Totally.
So we look kind of, where is your maximal strength? Where's our baseline? Where do we have to get to from here? Okay. And then we go through an endurance exercise as well, because if you think about it, pelvic floor is on all the time, right, when we're standing. So I have people hold their Kegel as long as they can, time how long that is. And then the other thing that some people don't realize or don't think about is the relaxation component as well of these muscles. So it's important to see definitely how strong are they, how well can you contract, but you also have to be able to lengthen and relax the muscles too. That's one thing we see a lot, is people coming in saying, oh, I've just had a baby, I've been doing my Kegels, like 100 Kegels a day. I feel like I'm strong, but I'm still having leakage. And so that's a huge misconception that we have in our society, is that postpartum, you're weak, you're long, you're loose, you need to strengthen.
Right.
I would say clinically, 85% of the people I see, their pelvic floor muscles postpartum are too tight.
Oh, wow.
Yeah. Because if you think about it, during a vaginal delivery, your muscles, they have to lengthen 2 to 3 times their normal length to have the baby pass through. And muscles, as we know, have an elastic property. So for them to come back together, sometimes they come back a little bit too tight, not to mention if there's tearing, if there's an episiotomy, there's a lot of scar tissue that comes with that. Right. If there's scar tissue and trauma to that area, the muscles are going to contract and they're going to guard. So what I tell people, we want to lengthen the muscles before we strengthen them, because tight muscles are not strong muscles. Tight muscles are weak muscles.
Right.
So that's a big education piece, and a big, I see a lot of light bulbs kind of go off in the clinic when I describe that. Yeah. And so I always tell people, kind of a check for if you have tight muscles is, if you do have your period and you're using, a Diva cup or a tampon, is it painful to put it in? The other one is intercourse painful? And so those are some little indicators to me that likely the pelvic floor is too tight and we need to work on lengthening.
Is there, just a quick question, is there a reason for them in the normal population, if someone is, let's say, having pain with intercourse, is there a reason for that, why that got so tight in the first place?
It's, multifaceted. So are they doing a lot of like HIIT workouts? Because every time we jump, our abdominal contents come up and then they slam back on the pelvic floor. A lot of my athletic population, runners, CrossFitters, F45ers, they all have quite tight pelvic floors. Stress is a huge component. I always tell people, how your traps or your shoulders get really tight when we're stressed? Same thing in the pelvic floor. So if you're in a stressful situation, so like say you get cut off on the highway and your whole body's tight because you're stressed out, your body relaxes, check in with your pelvic floor. Are you still holding? Are you doing a Kegel without even realizing?
That's so interesting.
Yeah.
Wow.
There's so many parts, right?
Yeah.
You left out Orange Theory. We like
Orange.
Orange.
Oh, sorry.
Right? Like, don't be discriminatory, please. Okay, so that's great. Like, wow. Okay, so that was a lot of information right there. I had no idea about, and very interesting. And I could totally see the link there. So that makes all the sense in the world. What in research, what has been the major outcome? Because obviously you're talking about that stuff. So right away I can see, like, obviously if they're doing the pelvic physio, that they're going to get a lot of these things, like, so incontinence, so some improvement in strength, coordination, right? All that stuff. What has the research really been showing in the last couple of years? And how long actually has this been around?
The research has been, it's been around for, 10 to 20-ish years for sure, but I think more and more people are starting to realize it a little bit more. But the research does show that strengthening the pelvic floor muscles when appropriate will help to improve or reverse urinary incontinence or leakage. One other topic we haven't really touched on that has really great research is in prolapse. So prolapse is essentially when, either your bladder or your rectum or your uterus drops down a bit in towards the vaginal area. Very common postpartum if you've had vaginal delivery. And there are actually 4 different grades of prolapse. So grade 1 and grade 2 is the organs fallen within the vaginal area, but it's not kind of at the vaginal opening at all. Grade 3 is it's right kind of at that vaginal opening, and grade 4 is it's actually protruding outside the vaginal opening. So grade 1 and grade 2 actually have quite good research into pelvic floor muscle training, can help reverse it by a grade. Grade 3 and grade 4, you're looking more to seeing a gynecologist likely, but I still, I tell people, keep doing your exercises, even if you're going to have surgery, even if you're going to have a pessary, because if you're not strengthening that foundation that holds everything up, likely you're going to see your symptoms come back in a year, 5 years.
Yeah, it'll happen again. It's like anything else. Always work on the foundational stuff. Always, 100%. It's almost like if you're going to do a surgery, it's almost like you got to go work out more, or you got to go strengthen even more, so that way your post-op is better.
That's exactly what I was going to say. I always relate it to, the knee replacement. You come in for physio before the knee replacement to make sure the muscles are strong, so that recovery is that much better.
Totally.
Yeah.
Totally. So how many times would somebody generally go see? I guess it depends obviously on what the issue is and things like that. But let's say I don't even know what's normal, but what would you normally see? What would be the normal length of a treatment? Would it be, all the way through past pregnancy as well? Like how do you do that?
Again, it totally depends on the person. If they're, having some symptoms here and there, nothing huge, we would probably have a 3 to 4 appointments, maybe 5 before delivery, depending on the person. And then postpartum, I definitely recommend that people come in about 6 weeks postpartum after they've been given kind of that okay. And so then we kind of reassess, where are we? Where were we before? Where do we need to get to? There's still a lot of change at that point. 6 weeks postpartum, your body's still recovering so much. And then after that, I'd say another 5 or 6 appointments. But usually we see more postpartum than we do during the pregnancy. And that's probably more of a function of, education and people not realizing that there's anything that they can do while they're pregnant.
Right. And I was just going to say that. I think more people will come to you after, because maybe they heard from somebody else or whatever. Oh, I should probably be doing this. And it's like, you should have come before, but you're here now, which is great, and let's help you. Exactly. And I know my wife went a couple of times at least after too, so that was totally get that.
And then there's some people. Oh, sorry, I was just gonna say there's some people who come in and you're kind of like, you know what, you're doing really well. Maybe we can check in a couple of months, but you can go on and do your normal activities, right?
Yeah.
Mm-hmm. So as chiropractors, we have prevention brain. We're always thinking, we want to prevent the problems before they get there. So is there any use in like a regular person, not pregnant yet, no symptoms, just checking in with a pelvic floor physiotherapist just to see if everything's good before they develop any symptoms?
Yeah, I mean, that's again, same kind of idea as what I was just saying. Like some people, they'll come in, people usually come in because they're pregnant or postpartum, just because that's a population that
Right.
knows about us, but definitely anyone can come in for an assessment. And you know what, maybe you do have a tight pelvic floor that maybe in 4 or 5 years will result in leakage. So it's a great thing that you came in now so that you can work on that prior to. But it wouldn't be an intensive treatment by any means, but definitely some good education and exercises that they can already work on preventatively.
Awesome.
So with all that, oh, you're going to say something?
I was just going to say, one thing we haven't really mentioned, or I haven't mentioned, is diastasis recti. And I know that's a big thing that people are concerned about these days. So diastasis recti is the separation of the abdominals. And I know people are quite concerned about it. And so a little education piece is when you're pregnant, you have the relaxin hormone going through your body, which we know affects connective tissue, and our ligaments and everything. And so it does affect that connective tissue that connects, you know, the 6-pack muscles. And so as the baby grows, those muscles kind of separate a little bit and that connective tissue will stretch across. And that's totally normal. It's okay for that to happen because the baby has to grow. What we try to encourage people to do is not make it worse than it has to be, you know? So no crunches, no sit-ups, no, you know, getting out of bed, doing your crunching forward, instead doing the rollover and sit up. And then postpartum, there's a lot of exercises they can do to kind of bring that abdominal together. And there are the odd people who, you know, it can't come back together completely, but there's a lot of good research going into how strong is your transversus abdominis, that deep core muscle. And if you can activate that muscle, if it's strong enough, you shouldn't have any issues with a bit of a separation in the abdominals.
Yeah, transversus for sure is the one that we've been taught a lot. At least in Australia, they taught me a lot about that. But
same with the States.
Okay, fine, whatever. I don't know about the Canadian docs though. So we're
who knows?
Yeah, who knows? They probably taught nothing. But yeah, I can't say that. Yeah, that one's a huge one, even for just regular back pain and all that. So, so is there an exercise though? Like you said, don't do crunches, don't do stuff like that. Can they do planks?
Not forward plank. Side plank, often we can give that to people. Forward plank still puts a lot of tension along that center area.
So is there an exercise that you'd say is good for, I mean, for just general, so now we're not just talking about pelvic floor, but like I'm thinking of the pregnant mom that still kind of wants to work out. Is there anyone you'd be like, that's a great workout to do? Like I like giving dead bug. I don't know if, yeah, I like giving dead bug as or Superman on balls, but that's not necessarily for a pregnant. But what would you say is your favorite exercise to give to, let's say, a pregnant mom that you'd say across like blanket you can give it?
Yeah, I would say bird dog.
Bird dog.
We're on our hands and knees and extend one arm, one leg. Yeah.
Yeah. Okay. Cool.
Yeah, that's my ideal one.
That's your ideal one. Okay. I can see us helping that out. Awesome. Yeah, that was, man, I learned so much, and it's almost already been time. That's like, man, I had no idea. So, all right. So people are listening now. They're like, okay, how do I go about going to see one, or how do they contact you? How would they reach you if they have a question, something like that? How would they reach you?
Yeah, so I have a business Instagram account. It's Alex Danks, DANKS .physio. And then you can email me as well. It's again, Danks, DANKS, physio @gmail.com. And I'm at Blueberry Therapy in Dundas. That's the clinic there. And then the Running Physio in Toronto. Very
cool. All right, so I'm going to make sure that's all going to be up in the show notes and on the on YouTube. So all the links are going to be there, so everybody can reach out if you want to. And, or even if you just have a question, right? It's so good to at least go straight to the source. And if people wanted to maybe read up a little bit more, or is there like a site that you would say has a lot of good information?
Yeah, so Pelvic Health Solutions, they're the company essentially that many of us take our pelvic health courses through, and they have a lot of good resources, a lot of good information. You can also find like a pelvic health physio in your area or your town through that website.
Perfect. Okay, so I'm going to make sure that's up as well, so people can check that out.
Perfect.
Oh, that was awesome. Thank you so much for joining us. I think you said this was your first podcast too, right?
Mm-hmm,
So this is,
mm-hmm.
You've been christened in the podcast world. Welcome to the tribe.
Thank you.
So yeah, thank you so much once again. And thank you everybody for listening. And don't forget to like, subscribe. And we got more information coming at you just like this. And if you want more information about Alex, make sure to click on those links. Likewise, any questions you guys have about this show or other shows, you can reach out to us and we'll be happy to help you. All right, have a great day, everybody. Thank you so much for joining.
Alex.
Thank
you so much, Alex. Bye-bye.
Bye.